Hello friends, welcome to Kavita Medicos Education, and today's disease condition is lung cancer. So this lung cancer is the number one or leading cause of death related to cancer in both man and in women. So this cancer can happen in any area or in any tissue or organ of our body. So it is a complex disease condition. Okay, so there are 100 different types of cancer found. Okay, so today we are discussing with the lung cancer. So before going to the definition of lung cancer, let me explain the term about the cancer. So what is cancer? So cancer are the abnormal or unhealthy cells of our body which will grow and proliferate in uncontrolled manner. Okay, they will form a tumor or mass in our body that is called as cancer. So how our normal or healthy cells work? So when the normal or healthy cells will come in contact, okay, when they will come in contact with each other, then they will show the property of contact inhibition. Okay, so this contact inhibition property is shown by the healthy cell. So what is contact inhibition? It means when healthy cell will come in contact with each other, they will stop their growth. Okay, the growth is stopped in the normal healthy cell. It is called as contact inhibition property. This contact inhibition property is lost in the cancer cell. Okay, they will not show the property of contact inhibition and they will grow in an uncontrollable manner. Okay, next, if our healthy cell will divide, okay, they will have a binary division. Our healthy cell will divide and again they will divide. Okay, so our healthy cell have a fixed lifespan. For example, our RBC have 120 days lifespan. Okay, when this 120 days completed, then that RBC will get die. Okay, so our healthy cell, after doing their function or after they are working, they will go into a dying process that is known as apoptosis. This apoptosis process is lost in the cancerous cell. It means the cancer cell will never die. Okay, the cancer cell will never die and they will divide in an uncontrollable manner and they will proliferate in an uncontrollable manner and they will form a tumor into our body. Okay, so it is a apoptosis, a normal dying process of any cell which have done its function, or if our cell get injured through anything, then it will go into apoptosis process. But in case of cancer cell, they will never get die or they will not show the property of apoptosis and they will form a tumor or mass in our body that is called as cancer. So let's start the definition of lung cancer here. So lung cancer is a malignant condition. So it is a type of malignant cancer. So there are two types of cancer. First we have benign. Okay, benign means, so benign cancer means the cancer which remain localized at fixed site. Okay, this benign cancer get localized or it remain fixed at a site. Okay, it will not spread to other tissue and other organ. Okay, and it is easy to treat benign cancer. Through the surgery we will cut this benign cancer and there are very less chances that it will come back again. But in case of malignant cancer, it is a dangerous type of cancer condition. Malignant. Why it is malignant? Why it is dangerous? Because this malignant type of cancer can spread to other tissue and other areas of our body. Okay, and again it is a cancerous disease condition because it is spreading into our body, and even after the surgery or after the treatment of cancer, there are high chances that it can come back again. Okay, so it is a dangerous disease condition. So lung cancer is a malignant cancer, means it is a spreading cancer. It can spread to other organs of our body. Condition characterized by, so what are the characteristics of cancer cell? So cancer cells show the characteristics of uncontrolled growth, means they will stop or they will not show the property of contact inhibition. They will grow in an uncontrollable manner and there is a division of abnormal cells, means the unhealthy or cancerous cell will divide in an uncontrolled manner. Okay, and will form a tumor or mass in our body. So this all process are happening in the tissue of the lungs. Okay, so it is happening in the tissue of the lungs. So which area of our respiratory system is get affected through the cancer? So it arises in the cells lining. Okay, so mostly which cell? Epithelial cells. this type of cancer which happen in the respiratory system, it mostly affect the respiratory epithelial cells of our body. Okay, so it arise in the cells. Which cell? Epithelial cells in the lining of which part? In the lining of airways. It means it is happening in the small airways into our respiratory system, like bronchi and bronchioles. Okay, so when trachea will bifurcate or divide into each lung, then this trachea or windpipe, when divide, it is called as bronchi. And again this bronchi will go deep inside into our lungs and will proliferate and will go deep inside our lung and will divide further into several small branches which are known as respiratory primary bronchioles, secondary bronchioles, tertiary bronchioles, terminal bronchioles. Then comes the alveolar duct, and finally the alveoli, the respiratory unit which are known as alveoli. Okay, where the actual gas exchange take place. Okay, in this way this branch get divided into our respiratory, into our lungs. Okay, so this cancer is going to affect our bronchi as well as our bronchioles, means our small air passages. Okay, so it will affect our bronchi, these bronchi, and our bronchioles also, but can also begin in areas of respiratory system. So it can also happen in other areas of a respiratory system, like trachea, means it can also affect our windpipe as well as our alveoli, our respiratory unit where the actual gas exchange takes place. Okay, so if left untreated, if cancer is not treated in first stage, or if we have not treated the cancer, then what will happen? This malignant cancer, because lung cancer is a malignant cancer, so this growth can spread beyond our lungs. Okay, it can spread to other areas, other organ, other tissue of our body. Okay, so it can also spread to the pleural cavity of the lungs and in the lymph nodes of the lungs. Okay, it can also affect our liver, adrenal gland, kidney, and to the brain also. Okay, so this process of spreading of malignant cancer to other tissue and organ in our body is known as metastasis. Okay, so what is metastasis? Metastasis means the spreading of cancer to the other tissue and organ is known as metastasis process. Okay, so this was the definition of lung cancer. Next we have types of lung cancer. So here the types of lung cancer have been divided into two categories. Okay, so first type we have small cell lung cancer, and next we have non-small cell lung cancer. So first we will discuss about the small cell lung cancer. Okay, so here the cases are 20 to 25% of all lung cancer. Okay, so as the name is indicating small cell, it means if we see the cell size through the microscope, then in this type of cancer or in this type of tumor, the cell have small shape and size. Okay, so these are composed of small round cells that grow rapidly. Okay, so in small cell lung cancer, the cell shape and size is in a small form and they are in a round form. Okay, but they will rapidly grow in our body. Okay, they will spread the tumor in a very fast rate. Next we have, it is the most aggressive form of lung cancer. Okay, so it is most dangerous kind of cancer. The survival rate of the patient is very less because it is aggressive form of cancer. It means it have a fast metastasis process. It can spread to other organs of our body also because it has aggressive nature. The cell, the tumor or the cancer nature is very aggressive, so it will quickly or rapidly spread to other organs of our body. Next we have found near central airway that affect the whole lung. Okay, so firstly this type of tumor will generate in the central region of our airways, of our lungs. Okay, so which is the central region? Okay, so if this is a trachea, okay, this is a windpipe. Now this windpipe is being divided into two parts. Okay, it will bifurcate into each lung. These are known as bronchus. Now the entering point of the main bronchus is known as hilum region. Okay, is known as hilum region. So the entering point of this main bronchus is known as hilum region. So this is central part. Okay, so it will affect the central region of our lungs. Okay, so first this type of tumor will grow in the central airways. Okay, and then it will spread to other area of the lungs, like the edges or the peripheral region of our lungs. Okay, so it will affect the central or hilum region of our lung, and then it will quickly spread to the whole lung also. Next we have strongly associated with the heavy smoking. So who are the people smoking? Means the people who do active smoking. Okay, so it is associated with the smoking condition, who do the heavy smoking. Okay, so S for small, S for smoking. So the people who are active smoker is the leading cause for causing the small cell lung cancer. So it is the main culprit of small cell lung cancer. Next, at the time of diagnosis, mostly found when it has metastasized to other parts. Okay, so as I told you, it have a high growing speed, it is an aggressive form of cancer, so it have a metastasis, it have a high metastasis process, so it can metastasize to brain, liver and our bone also. Okay, and it have a poor prognosis. Mainly the patient are detected when they have gone in the 4th stage of lung cancer, because it can spread to other organs of our body quickly. Okay, it is an aggressive form of lung cancer, so the diagnosis are mainly poor. Okay, it is done at the 4th stage of lung cancer or 3rd stage of lung cancer. Now come to the non-small cell lung cancer. So the name is indicating non-small cell. It means the cell size is in a large form. These are undifferentiated cell. Okay, they do not have any shape and size, they are undifferentiated and they are in a large form. So their spreading and growing rate is very slow. So these type of lung cancer or tumor have a slow spreading and growing rate, but they are the most common form of lung cancer. Okay, they form 85% of cases of all lung cancer. Why? Because it has 3 major subtype. Okay, in non-small cell lung cancer we have 3 subtype also. First we have squamous cell lung cancer, next we have adenocarcinoma, and next we have large carcinoma. We will discuss these 3 one by one also. Next we have found near central and peripheral region. So it can happen in anywhere in the lung. It can happen in the central region as well as in the edges or periphery of the lungs also. So next we have subtypes of non-small cell lung cancer. So there are 3 subtypes of non-small cell lung cancer. First we have squamous cell carcinoma, then we have adenocarcinoma, and number 3rd we have large cell carcinoma. So let's discuss with the squamous cell carcinoma. So as the name is indicating squamous cell, it means this type of tumor or cancer will happen in the squamous cell. Okay, so the cases of squamous cell carcinoma are 30 to 40% of all lung cancer. Okay, so it arises in the squamous cell lining the central bronchi. So this type of tumor or cancer will occur in the squamous epithelial cell which lines the central bronchi. Okay, so here when the trachea or windpipe divide into 2 branches into our each lung. Okay, now these branches are known as bronchi. And now this bronchi will again divide into primary bronchi, secondary bronchi, tertiary bronchi, terminal bronchi. It means it will proliferate into many more small sub branches. Okay, so this type of tumor will occur in the large airways, in the large bronchi. Okay, so it will occur in the lining of epithelial cell. Okay, so it will occur in the lining of this airways. Okay, so it will occur in the large airways lining. So this type of tumor occur in the squamous epithelial cell which lines the central bronchi or the large bronchi, because the large bronchi will be present in the central region. When again these branches will divide further, then they convert into smaller branches, and the smaller branches will come in the peripheral area in the outer region of the lungs. Okay, next occurs in the central part of lungs. Okay, so this type of tumor occurs in the middle or central region of the lung. It means it will affect the central bronchi or larger bronchi of our lung. Okay, mainly we can say that it will occur in the hilum region. So which region is the hilum region? When this trachea divide into 2 branches known as bronchi, and this entering point of large bronchi is known as hilum region. So the central region is known as hilum region. So it will occur in the central part of the lungs. Next we have smoking or history of smoking. So what is the causative factor? Okay, who are more prone to this squamous cell carcinoma? So the people who have done past smoking, who have a history of past smoking condition. So it will occur in the person who do the active smoking in the past. Okay, they have a history of smoking or any type of tobacco smoking. Next we have common in man. So if we compare to the ratio in female and man, then it will occur more in man as compared to females. Next we have liver, adrenal gland, lymph node. So this type of tumor have metastasis process, and if this metastasis will happen, then it will affect and will cause tumor in the adrenal gland, in the liver, and to the lymph nodes. Now let's come to the adenocarcinoma. So the cases of adenocarcinoma are 40 to 50% of all lung cancer. So here the tumor or cancer will affect the glandular epithelial cell. Okay, so adenocarcinoma tumor occur in the glandular epithelial cells, and these glandular epithelial cells are those cells which secrete the mucus. Okay, and these glandular cells are present in the alveoli. Okay, so what are alveoli? Alveoli are the respiratory unit. So in this alveoli there are glandular cell present. Okay, so adenocarcinoma or tumor will happen in the glandular cell which secrete the mucus. Often occurs in smaller airways. So as if we compare to the squamous cell carcinoma, it occurs in the large airways, but this adenocarcinoma tumor will occur in the smaller airways which comes at the periphery of the lungs, in the outer region of the lungs. Okay, so it will cause tumor in the smaller branches of our airways. Okay, in the narrow airways, in the tiny airways. Next we have non-smokers and women. So who are more prone to adenocarcinoma? So non-smokers. So who are the people which come in the category of non-smoker? The people who are passive smoker, okay, and the occupational worker who work in the lead industry, in the arsenic industry, and the peoples who are more prone to the air pollution every day. Okay, so those people will come under the adenocarcinoma cancer. Next we have women. So why women? Because in women estrogen hormone is secreted during the menstruation period. Sometimes when the estrogen hormone is secreted in a higher level, then this estrogen hormone can affect or can do stimulation in the glandular cell and can convert this glandular cell in the tumor cell. So in women during the menstruation period, when the estrogen level get increased, then this estrogen hormone trigger the glandular cell and may convert this glandular cell into the tumor cell also. Found in the outer regions of lungs. So this adenocarcinoma occur in the outer and in the peripheral area of our lungs, in the outer and peripheral region of our lungs. Slower than other types. So this type of tumor has slower growing rate and slower metastasis process as compared to squamous cell carcinoma and large cell carcinoma. Now at the last we have large cell carcinoma. So the cases of large cell carcinoma are 15 to 20% of all lung cancer. So this type of tumor or cancer have a name large cell. It means if we see the cell of this tumor or carcinoma through the microscope, then in microscope these tumor cell appear larger than as compared to normal cancer cell. Okay, that's why it is called as large cell carcinoma. So cancer cell appear larger than a typical cancer cell. So this type of tumor appear larger in a microscope when we will see through the microscope. So this cancer cell will be appear in a larger or in a big form, in a undifferentiated or in a irregular form. Okay, next we have can appear anywhere in the lungs. So this tumor can happen anywhere in the lungs. It can happen in the middle area also, it can happen in the peripheral or outer region of the lungs also. Okay, it means it can affect anywhere, it can happen anywhere in the lungs. Next we have grows and spread quickly. So this type of tumor grow very quickly, it have a higher metastasis process, it will spread to other areas of body like brain, liver, adrenal gland, to the lymph nodes in a quick way as compared to squamous and adenocarcinoma. So here the diagnosis are very poor. Okay, so next we have causes and risk factor for lung cancer. So first we have smoking tobacco, that is active smoking. So in smoking there are 7,000 more chemicals are present, out of which 70 are carcinogenic factor. Okay, so any kind of smoke like pipe smoke, cigar smoke or tobacco smoke is harmful for our body and it can lead into a lung cancer. Next we have second hand smoke. It means the passive smoker. It means the person is not doing the smoking but his sitting around those people who are doing the smoking. Okay, so if he will inhale that air, it means he can also have the lung disease condition. Next, we have exposure to radon. So this radon gas is present in our environment. It is tasteless, odorless and smellless gas. Okay, so from where the radon is coming into our environment? It is coming from the soil, rocks and water, because in soil, rocks and water there is a chemical present, it is known as uranium. When the rock and soil break down, then it releases the gas that is known as radon gas. Okay, so radon gas is the second leading cause for lung cancer. Next, we have occupational exposure. So the workers who are working in the coal mining industry, in the shipyard industry, they inhale the chemical known as asbestos. Okay, so this asbestos chemical is very harmful for our body and it can lead into a lung cancer disease condition. Other than this, there is silica dust, there is arsenic, there is cadmium type of chemical present, which can also lead to the lung cancer disease condition. Next, we have air pollution. Nowadays, the air pollution is increasing day by day. Okay, so in air pollution there are chemical fumes present, there are air particles present and there are diesel exhaust present. Okay, so due to the inhalation of air pollution for long duration will lead into a lung cancer disease condition. Next, we have genetic mutations. What is genetic mutation? It means there is some changes into our DNA. So if the DNA of the cell will get converted or will get changed, then the normal cell will convert into a cancerous cell and that will lead into a lung cancer disease condition. If any person is having a family history of lung cancer disease, then this disease will transfer into our upcoming generation. It is a hereditary disease condition. Next, we have weakened immune system. If person immunity is weakened, okay, due to poor diet or due to HIV disease condition, then our immune system, that is known as our defense mechanism, will not able to save us from a cancerous cell. Okay, so if we are not taking a good diet which is rich in fruits, vegetables, a balanced diet, then automatically our immunity will get weak and our immunity will not able to defend ourselves from the cancerous cell. Next, we have age older. So the people who are more than 50 years of age are automatically comes in the category of lung cancer disease condition, because it's a body genetic or it's a body mechanism. After the 50 years of age, our body goes into a deformation process. So elder people are more prone to the lung disease condition. Next, we have previous radiation therapy. If we are taking radiation therapy frequently for like breast cancer or for benign cancer, then this harmful rays which are coming from the radiation therapy, they will convert the benign cancer into the malignant cancer and they will convert the cell DNA, and which will lead into a mutation process and will automatically convert our normal cell into the cancerous cell. Next, we have history of chronic lung disease. If any person is suffering from a chronic lung disease condition, like if he is having a COPD disease condition, he is having a pulmonary fibrosis or tuberculosis condition, then it will lead into a lung cancer disease condition. So this was the etiological factor for the lung cancer. So next, we have stages of lung cancer. So the stages of lung cancer is given by the American Joint Committee of Cancer. Okay, so it have given the stages of cancer on the basis of TNM staging. So what is TNM staging? So T means tumor size. What is the size of cancer cell or tumor cell? Next, we have N. N means node involvement. Is there any lymph node around the lung is involved or not? Next, we have metastasis. Metastasis means what is the spreading rate of cancer? Is the cancer have spread to other areas and other organs of our body or not? Okay, so this TNM staging is given by American Joint Committee. Okay, so this TNM staging is only done for only the solid type of tumors. Okay, this TNM staging is done only for solid type of tumor. Okay, solid type of tumor means the tumor which does not have any cyst or watery appearance. So here we have 4 stages of lung cancer. So before discussing the 4 stages of lung cancer, there is one more stage of lung cancer, that is known as stage 0. It is also known as carcinoma in situ, or it is also called as hidden stage, because in this stage 0, patient does not have any sign and symptoms of cancer and patient lives a normal life. Because in stage 0, the cancer cells are developing in the innermost layer of our bronchi and bronchus. It is in the stage 0, okay. That is why it is also called as hidden stage, okay. It is a secret stage where patient does not have any sign and symptoms of cancer. So here we are discussing the stages of cancer on the basis of TNM staging. So first stage we have stage 1. So what is the size of tumor? So TNM, on the basis of TNM, the tumor size is 3 centimeter. So tumor size can be 3 centimeter. It means it can be close to 3 centimeter, or it can be less than 3 centimeter. Next, what is there any lymph node involvement? No, there is no lymph node involvement. There is an absence of lymph node involvement. This all process is taking place in one lung, excluded main bronchus. It means this tumor have generated only in one lung, okay, in the one lung segment, okay. Suppose this is right lung and this is our left lung, okay. So right lung have 3 lobes and left lung have two lobes. So in stage first, the cancer size is 3 centimeter or less than 3 centimeter. It is a main bronchus of windpipe. These are bronchi and bronchioles, okay. So in stage first, the tumor size is small, that is 3 centimeter or less than 3 centimeter. And this tumor is generating only in one lobe or one segment of the lung, okay. It have no metastasis process, and it have not involved any lymph nodes around the segment of the lung, okay. So it is stage first. So this stage first cancer is a curable type of cancer, okay. It can be treated with the help of a surgery, and after that patient have to take radiation or chemotherapy in some cases, okay. So the survival rate of stage first is about 80 to 90%. Next, let's come to stage second. So here tumor is greater than 3 centimeter. Now the tumor have increased in size. It is more than 3 centimeter. This tumor size is more than 3 centimeter, okay. Spread to lymph nodes in the lung. It is spreading to the lymph nodes around that segment, okay. Now this tumor is spreading to the other lymph node nearby lung, okay, nearby the same lung. So more than one tumor in the same lobe. So in this stage second, there can be more than one tumor can be generated. So other tumor can also be generated in the same lung and in the same lobe, okay, in the same segment. So one lobe is involved where more than one tumor can generate, and the tumor size is greater than 3 centimeter, okay. And nearby lymph nodes are involved in this process. No metastasis outside the lung, but there is no spreading of cancer outside the one lung, okay. The cancer have not spread to other lung and to the other area and other part of this lung. So stage second is also curable through the surgery and by radiation and chemotherapy as well. Next we come to the stage third, okay. So here the tumor size is greater than 7 centimeter. Now the tumor have increased its size and it is more than 7 centimeter. Spread to lymph node outside the lung, okay. Now this type of tumor have spread to the lymph nodes which are present outside the lung, It means the lymph nodes which are in the center of our chest, means the mediastinal lymph nodes are involved in this process. The main bronchi and bronchus is involved in this process, and more than one tumor in different lobes. Now other segment have also generated a tumor, and the tumor size is more than 7 centimeter. It means this type of tumor is generating in the other segment and other lobes of the lung, okay. And there is a metastasis process to the other lymph nodes which are present in the center and in the mediastinal area of our chest. So it was stage third. Next we come to the stage fourth, which is also called as advanced stage of cancer, because in this stage the cancer is spreading to other areas, other organs and other body part, okay. So this type of cancer can spread to the brain, liver and bones, and the survival rate of the patient are very less. Although radiation therapy, chemotherapy and through the immunotherapy, we can give a better life to the patient. Okay, so it was stage 4th, which is the advanced stage of cancer. Okay, because there is a high spread of cancer, there is a high metastasis process to other lung also and to other organs of our body also. So these were the stages of lung cancer. If you are liking my videos, so please do support me and like, share and subscribe to my channel. Thank you.